pain is very prevalent in many people's lives in the U.S. and around the world. Opioid pain medication is also an issue for many people who are seeking drugs for their addiction. I am talking about the pros and cons of prescribing pain medication to patients. Prescription drugs have been a drug of choice over the last 20 years because they are easily accessible and they're prescribed by a doctor, which gives many people the misconception that they're safe. All it takes is a cocktail of medication put together to kill someone. So pain medication can be very dangerous. Although opioid pain medication offers relief from short-term and chronic pain, according to an article called Long-Term Consequences of Chronic Pain, it states that chronic pain negatively impacts multiple aspects of a patient's life and health, including sleep, brain function, mood and mental health, cardiovascular health, sexual function, and overall quality of life. Chronic pain can be more difficult to treat over a period of time and can cause complications that can also incur economic consequences. On the other hand, an article called Prescription Opioid Abuse, Pain, Addiction, and Clinical Issues and Complications, it states that recreational prescription drug use has become an epidemic since 1990. Opioid non-medical use has increased threefold. To give you an idea of what that looks like, as of 2008, an estimated 13.8 million people aged 12 years and older have used opioid oxycodone for non-medical use at least one time in their life. Treatment admissions have increased 400% since 1990, from 1990 to 2008, escalating from 52,840 in 2003 to 120,877 in 2008. But pain is also a huge problem. According to an article, Long-Term Consequences of Chronic Pain, it is estimated that 1/3 of all adults in the U.S. are dealing with chronic pain. Although long-term use of opioid drugs can negatively affect the body and the mind. According to paindoctor.com, use can cause physical short-term effects like sedation, nausea, constipation, confusion, itching, and dry mouth. Long-term side effects include also constipation, nausea, tolerance, which is where your body gets used to the drug so you need more for the same effect. Physical dependence, which is where your equilibrium is adapted to the drug, causing withdrawal if you suddenly stop the drug. Addiction, which is where a person becomes compulsive for using the drug and seeking the drug out. Addiction is a behavior problem and is separate from dependence and tolerance. There is something called opioid endocrinopathy, which affects libido, fertility, fatigue, depression, anxiety, loss of muscle strength and/or mass, increased osteoporosis, and menstrual irregularity in women. It also may cause immunosuppression, which increases the risk of infection and suppresses cellular immune response and antibody production. Another possible side effect is opioid-induced hyperalgesia, which is when a patient is taking opioids and then becomes more sensitive to pain. But when a person deals with chronic opioid pain medication, opioid pain medication can significantly improve a person's well-being and daily life. According to paindoctor.com, opioid pain medication and the way it works is that it attaches to a receptor which prevents pain signals from traveling to the peripheral nervous system, to the spinal cord, and then to the brain, which prevents perception of pain. It also promotes a significant suppression and changes the limbic system in the brain, which is responsible for certain behaviors, emotions, and memory. According to an article called Discerning Drug Seekers from Patients Really in Pain, the dilemma for physicians are prescribing pain medication is treating a patient who is truly in pain or possibly enabling an addict to continue their addiction. Doctors really have no way of deciphering the difference between the two patients. But on the other hand, physicians also have the opportunity of bettering the quality and well-being of a patient's everyday life who is dealing with chronic pain. I chose this topic because I suffer from fibromyalgia with chronic pain, and I'm a nursing student, which makes this topic very interesting to me. There is a fine line to follow a very strict program that will safeguard the life and well-being against possibilities of having negative effects while utilizing pain medications as a tool to maintain a better quality of life. The way to maintain a better quality of life and do that is to have a strong awareness of the benefits versus the detriments, which are necessary for the physician and the patient while maintaining good communication between them, which is vital to the outcome.